Hey, thanks for making it to Veterans Info Tap. I'm glad you made it. I wanted to talk to you about an article that got sent out by the Office of the Inspector General for the VA with regard to severe occupational staffing shortages for fiscal year 2023. We're coming up on the tail end of that fiscal year, and it doesn't sound good. So, wanted to share with you this information. This is specific to the VHA, which is the Veterans Health Administration, which, there's three, it's three-headed monster. VHA, VBA, Benefits Administration, and then you have your national cemeteries. So specific to the Health Administration. So with that, let's go ahead and jump into it. Hit the thumbs up for me, subscribe, share with a friend, all that good stuff. I really appreciate it. Let's get rolling. This came out on 8/22, August 22nd, 2023. And it states here, the VA Choice and Quality Employment Act of 2017 requires the VA Office of Inspector General to determine annually a minimum of 5 clinical and 5 non-clinical Veterans Health Administration occupations with the largest staffing shortages within each VHA medical center facility. The OIG conducted a review to identify those severe staffing shortages by occupation. The OIG also compared the number of severe occupational staffing shortages against the previous 4 years' reports to assess changes. The OIG surveyed VHA identified facility points of contact to determine severe occupational staffing shortages at each facility. Among the most significant findings in this year's staffing report were the following. And you got a couple bullet points here. Let's jump into them. Facilities reported 3,118 severe occupational staffing shortages across 282 occupations in fiscal year 2023. This was an increase from 2,622, so about 500-ish more increase. Severe occupational staffing shortages across 285 occupations in fiscal year 2022, following annual decrease during fiscal year 2018 through fiscal year 2021. 88% of facilities reported severe occupational staffing shortages of medical officer, and 92% of facilities reported severe shortages for nurse. Practical nurse was the most frequently reported clinical occupation with severe staffing shortages, and medical support assistants was the most frequently reported non-clinical occupation with severe staffing shortages. Medical support assistants was also the most frequently reported hybrid Title 38 severe shortage occupation. All 139 facilities surveyed reported at least one severe occupational staffing shortage. The Veterans Access Choice and Accountability Act and the VCQEA provide a mechanism for the Secretary to grant VHA direct hire authority, expanding the candidate pool for hybrid Title 38 occupations based on severe shortages. In fiscal year 2023, more severe occupational staffing shortages were reported by more facilities than in recent fiscal years. The total number of severe occupational staffing shortages increased by 19% relative to fiscal year 2022. Ridiculous. Let me click on this and see what else happens. And let me tell you this. My thought is, instead of just reporting the numbers, right, that ends the report. So, fine, you have the numbers, and guess what? Direct hire, who cares, right? If people aren't applying and you're not getting a good enough pool of applicants, two things are going to happen, or two things could happen. One, you could lower the threshold for applicants, that's the direct hire, and see if the quality remains the same. Or is that lower threshold going to lower the quality potentially? right? So very likely that if you start lowering the bar for some of these positions, the quality of candidates will diminish a little bit. Not saying that you're not going to find a good person by doing that. You are, but you're also going to get more not qualified people, or you know what I mean. The quality is going to drop a little. Now, the other thing you could do, and this is what I would be a fan of, and look, I'm no expert, right? This is just popped in my head as I'm reading this thing, is you could actually figure out why. Okay, so there's two ways to figure out, well, I mean, whatever. Let's focus on one way. Exit surveys from all the people that are leaving, right? What is our attrition rate within the VHA for those specific fields? It's not like they just opened up a bunch of positions. Well, I mean, they are, but it's not like that's all it is. Hey, we opened up 100 new positions and now we're short 100, right? It's not just that. People are also leaving. So you opened up 100, but you also lost 100, right? So now you need 200. So of the people who are leaving the VHA, the question is, why? Right? So do an exit survey, try to dig in, and I'll tell you what they should do is they should do an exit survey from the person who's leaving. They should also do an exit survey from the direct line supervisor, whoever is that person's boss, right? Because chances are there's been some conversations, right, about, hey, I'm not paid enough. Hey, I'm getting ready to leave. I found a better job, whatever, right? And there should also be a survey there on why Joe or Jane left, right? And I could venture to guess here that more than likely, or at least likely as not, it's pay. Even though the GS level workers or federal system workers, because not all federal people are GS, it's just that's the bulk of them, but the federal system has geographic bumps in pay depending on where you're at. Somebody who's working in Alabama somewhere is going to get paid less doing the same job as somebody who is in San Francisco, California, right? So just be based on the geographic cost of living and so forth. So they'll have the bump. The bump in a lot of cases is not enough to substantiate taking that job when they can work across the street, because guess what? Everybody's in need of medical providers, right? Whether it's doctors, nurses, what have you, right? So there is a need for those positions. And for most people, if you can make more across the street, why wouldn't you, right? And for most people, they're not looking for, hey, I'm off on the weekends and, this and that. They're just trying to make as much money as they can within a certain age range, right? Once you get over a certain age range, then that becomes less important usually, and your time and flexibility become more important, right? And so you're able to kind of leverage into that. But for the bulk of these newer medical professionals, they're looking for, how much can I make today? I have bills, right? I need to save up money. I need to do this, whatever. So here it is. If that's what the results are, which I don't know because I never ran the surveys, but if I surveyed the outgoing people and I surveyed the bosses or direct line supervisors, and the results came back at 70%, 75% of the reason why I have this attrition is due to income, then I'm going to probably petition somehow, some way to get some sort of specialized bump. Now, stick with me. Maybe it's not a forever bump in pay. Maybe it's, hey, there's a hiring bonus. Or, hey, the first 2 years you get an extra, whatever, $30,000 a year for the first 3 years or something, right? Get them into the program, right? Get them into the VA. Get them working with vets and all that stuff. Get them used to the weekends off. Get them used to working in that environment and start to enjoy certain aspects of it and get used to it. then it's harder to leave, even if you can go make $50,000 more across the street. You've gotten used to living this way. You've had a few pay bumps, and maybe it's a graduated thing. Maybe you start off with a $30,000 a bonus for the first year, $20,000, $10,000, right? So that way is your COLA, or your not COLA, but your raises that happen every year can kind of help bridge that gap, right, as it switches. And then, right, have it taper off. And then now it's harder for them to leave because they're kind of used to it. They got in the groove, all that stuff. So you can kind of throw those golden handcuffs on them for a little bit. Or maybe it's after 3 years, you get a $70,000 bonus, or after 5 years you get a $100,000 bonus, and keep them there for 5 years. Then you pay them $100,000. That was $20,000 extra a year, but it was a one-time thing and you're done, and then they're just back to their normal pay. So we can actually keep these people in there. So anyway, with that, kind of my 2 cents. Thanks for watching. I really appreciate it. Have a great one. And remember, if we don't take care of each other, something went wrong.